Hi, Dr. Barry Glazer, orthodontist in Cortland Manor, New York, with some more questions from our mailbag. So this is going back to a question that we've already answered, but I wanted to spend a little bit more time on it. And the question is, what do I do if I have an emergency after hours? So in addition to calling us at the office, sometimes you can't always get to us. Maybe you're on vacation, or maybe this is just another time where you can't get to the office. So there are some things that you can do at home to help to handle minor emergencies. So what are the most common? Well, the most common emergencies are going to be with braces. And the two most common problems are a loose bracket or poking wire. So let's talk about the poking wire first. So the brackets are braces that are glued to the teeth, and then we thread a wire through the braces. And occasionally, through tooth movement, that wire can shift, and sometimes it can stick out the back brace and it can poke you in the cheek. So there's a couple of things to do for that. Number one is good old-fashioned orthodontic wax. You get that in your survival kit when you get your braces from us. If you don't have any, you can always purchase it at a pharmacy, but you can get it from us for free. And it can be very useful for problems like this. So you take a small piece of the wax, roll it into a ball, maybe the size of a pea, and just stick the wax onto the back part of the brace where that wire's poking out, and temporarily, if it's a weekend, or again, if you're on vacation, and that can help to cover up that sharp wire and help to make things a lot more comfortable. Sometimes at the beginning, patients can get some canker sores just from the braces rubbing against the lip, and the wax again can be applied directly over a brace, just kind of mold it in there, and it can help to reduce those rough edges and help to get you through those first couple of days of soreness. So that's orthodontic wax. Make sure you always have some handy at home and have some in your travel kit. You can also use orthodontic wax for Invisalign problems. Now, thankfully, there's nothing to really break with an aligner, but occasionally, especially for adults, sometimes there may be a gap between the aligner and your gum, and that gap can sometimes be irritating. Well, you can use the same orthodontic wax like you do for braces, just a little bit differently. So in a situation where you have maybe a little bit of an edge irritating you, just take that wax and roll it into a little hot dog shape. That's not the best hot dog, but you get the idea. And then take the wax and apply it at the edge of the aligner, between the aligner and the gum, and it sticks on there pretty well, and that can help to smooth over any rough edges that might be catching on your lip. It's a lifesaver. Another thing to do with aligners is you can use the official Glazer Orthodontics aligner adjustment tool, also known as an emery board that you can get at CVS. But if you have a little edge, sometimes in the back, that might be catching your cheek or your tongue, you can take I recommend starting with the darker side, which is the rough side. Take the dark side of the emery board and just bevel back those little rough edges, and then flip it over and finish it off with the smooth side. And that can be very, very helpful for those little minor irritations, which sometimes can be pretty nagging and pretty uncomfortable. So those are things to do for poking wires and aligners. Now, what about if a brace comes off? So the braces are glued to your teeth. Now, we don't use crazy glue, although sometimes I'd like to, but we obviously have to get these braces off at some point down the line when your treatment's done. So we have to use an intermediate strength adhesive so the braces will stay on, but so we can get them off later. But things like chewing on pencils, chewing on pen caps. When I'm out and about, I get horrified at the things that I see patients chewing on. They're chewing on the caps from their water bottles. Foreign objects can get between your tooth and the brace, and it can pop one of the braces off your tooth. Now, the braces are clipped to the wires. So if you have a brace that comes loose and it's a weekend and it's not uncomfortable, you can just give us a call on Monday and we'll get you back in and we'll glue that brace on. If it's rubbing, or if it's flipped over and it's rubbing your cheek again, the best thing to use would be to use some orthodontic wax. We have two types. We've got regular wax, we've got silicone wax. The silicone wax is really sticky. And again, just place that wax over the offending brace. And for most patients on a weekend, a loose brace, although maybe concerning, isn't really something that we would consider a dire emergency. Obviously, if you're really uncomfortable, give us a call. But usually these home remedies can go a long way to getting you through the weekend. A couple of other things that I wanted to show you. One, we also give you this in your survival kit. This is Canker, and it's an ointment for canker sores, which are much more common with braces, much more common at the beginning. So make sure that you have that handy, especially in your travel kit, for those little nagging canker sores that can come up, whether or not you have orthodontic treatment. with braces or Invisalign. And the last thing too, especially with braces at the beginning, make sure you use your TheraBite. For the first 4 or 5 days after braces go on, the teeth can be sore. And research has shown that by biting on this TheraBite, it helps to reduce the soreness, make it go away about 50% faster than if you didn't do anything. And obviously you can always use over-the-counter medications as your doctor allows. So hopefully some of those remedies will help to get you through that concerning weekend, or when you're in Aruba and you have a problem with your braces, and then we'll take care of you when you get home. I'm Dr. Barry Glazer. Thanks for watching.